Alright, hello class, and this is my negative side to J.P. LaFontaine's affirmative for the debate of healthcare within the United States. So, judges ready, audience ready, timer starting now. Universal healthcare is an ongoing debate within the United States and will soon be highlighted in every single presidential candidate's speech while they are running for presidency in the year 2016. There is no doubt there is a problem with the healthcare in the United States. However, to say that there is 45 million people without healthcare, as stated by the affirmative, is kind of misleading. There are 45 million people without health insurance. Anyone who is ill can go into the emergency room and receive care. And of those 45 million, how many of them are between the ages of 20 and 35 who would choose not to buy insurance even if they have the financial means? I stand here before you to neglect that universal healthcare system will not work in the country of the United States, not now, not during the next presidency, and not ever, due to the current system already put into place and the transition between the two. The affirmative starts off his side of the debate by spitting out a number of facts to back up that the U.S. should obtain a universal healthcare system. His one source of this for all these statistics is the case for the universal healthcare written by Kao-Ping Cheng and Jack Ruthage of AMSA.org 2006. From this article, he reads, there is an uninsured excess annual mortality rate of 25%. That's 18,000 excess deaths in the age range of 25 to 65 per year, compared to that's comparable to diabetes, stroke, HIV, and homicide, according to the Institute of Medicine, or as I'll refer to them as IOM. In my research, I found an article at the NCBI of the U.S. National Library of Medicine of National Institute and the entitled Health Insurance Coverage and Mortality Rate Revisited, written by Richard Cronick, that discredits the IOM statistic. From this article, Richard Cronick concludes that the IOM estimate that the lack of insurance leads to 18,000 excess deaths each year is certainly incorrect. It is not possible to draw firm or casual inference from the result of our observational analysis, but is very but little evidence to suggest that extending insurance coverage to all adults who have will have a large effect on the number of deaths in the United States. There are reason to be skeptical of the IOM conclusion that the universal coverage would result in the annual reduction of the 18,000 deaths. First, the 25th percent confidence intervals is in each of the two studies that the IOM conclusions were drawn from were very large, stretching from the approximately no effects to increasingly mortality of 50%. Thus, even ignoring we could be pretty sure that the right answer is somewhere between 0 and 36,000 excess death. And as been discussed by Levi and Maltzer of 2004, it is difficult to draw inferences about the casual deaths between the lack of insurance and mortality from the kind of observational analysis relied upon by the IOM. So, moving on from the problems with the affirmative criteria, I would now like to build my case. First, contention number one: universal healthcare is just another step in the direction of socialism. It is not a government responsibility to provide healthcare for everyone. It should be worked for. Getting healthcare given to you to all citizens would be force people to rely on the government for assistance, forcing people to continue to vote in the direction of the ever-evolving socialist party within America. If healthcare is considered a right, then government bureaucrats will be making health, life, and even death decisions that should be up to patients and doctors to decide. Contingent number 2, the VA system. America already has a universal healthcare system in place for its veterans, and the system is under investigation right now for failing to provide adequate healthcare for this country's vets. Subpoint 1, the long waiting lists at the VA. I myself, being a veteran, I have seen these long waiting lists. I've waited up to a month just to go in and get a simple blood draw and even a physical. Not to mention the 3 months I had to wait to get an MRI done on my back for a service-connected disability for a back injury. Who's to say that the government won't have the same issues in universal health care that the VA does? So, subpoint number 2. Internal emails obtained by CNN show that top management of the VA hospital in Arizona knew that secret lists were part of an elaborate schema designed by the VA managers who were trying to hide that 14,000 to 16,000 sick veterans were forced to wait months to see doctors in this one hospital, some of them even being fatal conditions. So, with now establishing that the U.S. should be unable to switch to provide universal health care for the people, I would like to move back into a focus on the problems with the affirmative's contentions. Affirmative contention number 1. He gives the example of dominated by the few. To provide this list of big two different economic positions like Ford and Chevy, and to compare them to healthcare and the government, this can be dismissed because this is an example of single-payer healthcare, not universal healthcare. We are discussing, so universal healthcare refers to where everyone is covered by basic healthcare services, and no one is denied as long as they are legal residents of the United States, like example, the citizens of the country of Canada. They are charged taxes by the government to pay for their healthcare. The concept of universal healthcare is incorrectly equated to a single-payer government healthcare system, where all healthcare are not all the same. Americans would adopt the universal healthcare system over the single-payer health system due to its already adequate debt, and this only meaning one thing: higher taxes for the American people. Even though the U.S. taxes are low relative to other developed countries, according to the Tax Policy Center, the U.S. people tend to vote against rising taxes at all costs. Subpoint 1 of contention 1 is basically cost. In order to keep high quality of care and not falling into a failing system such as the VA, the money put towards universal care via taxes would have to be equivalent to the price of personal health care. So either way, the people are paying for it, just not paying for their own care, but everyone else's care at the same time. And how is that fair? If I take care of my health by not smoking, eating, and exercising, but pay for care for someone else who is, let's say, obese, smokes, and didn't put any effort to their own health, it is an individual's responsibility, not the government's, to ensure personal health. Diseases and health problems such as obesity, cancer, stroke, and diabetes can often be prevented by an individual choosing to live a healthier lifestyle. So, subpoint number 2 of contingent number 1 of the affirmative, the idea of the American dream, and that healthcare prices are the biggest threat to this dream. According to who? On May 2005, a group of 1,000. Who is this group? What is the source? Who gave the survey? Since there is no source given here, I can simply just say I disagree. My number one threat to the American dream, which to me is freedom. It is the government taking over, depleting our freedom, and the universal healthcare is a system that would just be another step into this direction. Providing a right to the healthcare is socialism, and is bad for the economic productivity. Socialized medicine is comparable to food stamps, housing subsidies, and welfare, all of which is charity. distributing charity to society makes people lazy. Decreasing uh, the the sorry the effectiveness of people to strive for excellence and inhibits productivity. Then onto the Declaration of Independence. Healthcare should not be a right because it is inconstant with the Declaration of Independence, which guarantees the right to pursue happiness, not the right to happiness. So basically saying that you have to push for it, you have to pursue it. Affirmative contention number 2. People wait to be treated because uninsured or because of being uninsured, which causes worse conditions and then makes more expensive care. I will argue that the people would be forced to wait for care due to the increase of people waiting for care with the universal health care. Just as I said earlier in the VA system, wait times could mirror those of the VA system already in place. Some veterans waiting years for health care and some waiting so long that it's too late. I have to disregard his subpoint number 2 since it's cut off by the 8-minute timer. So, to summarize, I have better evidence and sources that have completely disproven the credibility of his source and the sources that they rely on, and other facts have come from unknown sources that he uses. The affirmative confuses single-payer healthcare for universal healthcare. The VA system already needing to be fixed. So who's to say that the government would go or get a system right using taxpayers' money? Universal health care is a step in the direction of losing more freedom and by Americans set in place in socialized healthcare system. All right, thank you.